Thank you for investing the time to learn about our Qualified Health Information Networks integration use case as part of the MuleSoft Accelerator for Healthcare. Let's dive right in. Each one of us has experienced the issues with the patient onboarding process. Perhaps you've moved to a new place and want to establish a relationship with a new primary care physician. You walk into the office on the day of your appointment and are handed a clipboard. On the clipboard is a series of questions meant to help the doctor to learn your medical history. If you're like me, you may be thinking to yourself, isn't there a better way to do this? You may also be concerned that your doctor won't have a comprehensive view into your health, which can impact their ability to effectively care for you. Now, from the healthcare provider standpoint, this process isn't ideal either. It's manual, it requires time to be spent by its employees, like we see in the image here, to input the information provided, which is inherently error prone, and it doesn't serve as the best first impression with new patients. Needless to say, this process can certainly benefit from a software-enabled integrated solution. Before we demonstrate what we've built to streamline and automate this process, let's define a few key terms. A QHIN, or Qualified Health Information Network, is a network that securely shares health information between different organizations, like hospitals or clinics, and has met specific standards established by TEFCA, a U.S. government initiative which aims to create a nationwide network to support creating a more interoperable system. Think of QHINs as the nodes in this network that allow various players in the healthcare ecosystem with a programmatic approach to find and use patients' medical information to better serve them. Now that we've introduced our problem and defined some key terms, let's introduce the characters in today's demonstration. Charlie Duncan is an elderly patient who has recently moved from Wisconsin to California. John is a contact center agent at Mythical Healthcare and is a super user of Salesforce Health Cloud. His role is to help patients like Charlie. Victoria is Mythical's integration architect, who is responsible for integrating Mythical's key systems, including Salesforce. Charlie calls Mythical and is connected with John. Charlie mentions that he has recently moved to the area and has never visited Mythical in the past. Let's now navigate to Salesforce to see how John is able to help Charlie get onboarded into Mythical healthcare systems and begin his patient journey. John begins by opening the Health Cloud console and scrolling over to the Lightning web component entitled Patient Search. Knowing that Charlie is new to Mythical, he selects Network of Community Providers via QHIN, after asking Charlie if he would be open to having his onboarding process be expedited through the integration Mythical has established with a national network. Charlie agrees, and John asks him for some initial information, including his first name, last name, date of birth, address, gender, and phone number to query the network. At this point in the process, MuleSoft is searching the network to see which organizations have record of Charlie. When the results are returned, 3 organizations come into view, and Charlie recommends selecting Bethel Health, as they have the most up-to-date and comprehensive information regarding his medical history. After John selects Bethel Health, he is presented with a document that the organization has on file for Charlie. After telling Charlie the author of the document and the date the document was created, Charlie and John agree to use the document for onboarding Charlie as a new patient. At this point in the process, John is able to preview some of the details from this document and reads out some of the key elements, such as allergies and conditions, to confirm them with Charlie. After Charlie is confirmed, John clicks Sync, which will not only create an account for Charlie in Health Cloud, but also generate one in Mythical's EHR, so that when Charlie visits Mythical for the first time, his doctor will have the information he needs to most effectively and efficiently serve Charlie. The final step in John's workflow is he launches the account that has been created in Health Cloud, and as you can see, Charlie's information has been ingested into the appropriate objects and fields. Let's take a moment to recognize what we were able to accomplish with just a few clicks. First, query a network of providers. Second, locate and validate a patient's records. And third, create the patient in 2 key systems to simplify their onboarding process. Now you may be asking yourself, how is Victoria, Mythical's health integration architect, able to build these integrations? Being the savvy MuleSoft user that she is, she referred to the Accelerator for healthcare, which includes architecture and sequence diagrams, detailed technical documentation, as well as API specifications and implementation templates that can help jumpstart her integration efforts. She also leverages the provided Lightning Web Component to allow her Salesforce users the ability to interact with this newly built integration. That concludes today's demonstration. Thank you again for your time.